How has Thailand coped so well with COVID-19? Why has Thailand, with a population of nearly 70 million, been mostly spared the worst effects of the COVID-19 pandemic sweeping much of the world? Firstly, social distancing is embedded in Thai culture. Thais rarely touch when greeting, preferring the prayer-like Y gesture, rather than a handshake or embrace. Could this custom be at least partly responsible for the country's low numbers? There have been no overwhelmed hospitals in the country's public hospital system. No dead bodies in the streets. No social media postings from frantic doctors or nurses. The country simply acted swiftly, and with a determined force. Thailand was also quick to adopt the compulsory wearing of face masks, close their schools, and enforce social distancing on public transport. All that happened even before declaring a national state of emergency and curfew, sealing its borders, and forbidding interprovincial travel. Others have speculated that there is a genetic component that makes the immune systems of Thais, and other people living in the Mekong River region, more resistant to the coronavirus. Or is it some combination of all these factors that have insulated the country? And just recently a report in Brazil has been published, that antibodies from dengue fever might raise immunity against COVID-19. The report suggests a correlation between the mosquito-transmitted illness and the coronavirus, citing lower COVID-19 cases in areas with past dengue outbreaks, like Southeast Asia. You can find out more about that report in a link below this video. A public health expert at Bangkok's Chulalongkorn University, researching an outbreak of the virus in the southern border province of Pattani, noted that more than 90% of those who tested positive were asymptomatic, a much higher proportion than normal. He claimed Thais, and other people from this part of Southeast Asia, are more susceptible to serious cases of dengue fever, a mosquito-borne virus, than those from other continents. What we are studying now is the immune system. If our immune systems against dengue are so bad, why can't our immune system against COVID be better? One thing's for sure, despite an influx of foreign visitors early in the year from countries badly hit by the virus, especially China, Thailand has recorded less than 4,000 cases since January, and, as of September, only 59 deaths, along with a 96% recovery rate. Thailand's low infection rate appears to be shared by other countries in the Mekong River basin. Vietnam and Cambodia have recorded low case levels, although Myanmar recorded a new spike in new cases during September. Still, much lower than other Southeast Asian nations. Even Yunnan, the southwestern Chinese province through which the Mekong flows, had fewer than 200 cases. Thailand's Center for COVID-19 Situation Administration says they don't believe it's got anything to do with immunity or genetics alone. A spokesperson says it has to do with culture. Thai people do not have body contact when we greet each other. This is how the countries in the Mekong region greet each other as well. Thailand appears to have brought the virus well under control, but the outlook didn't always look so positive. In January, Thailand confirmed the world's first case of the virus outside China, in a tourist from Wuhan, the central Chinese city where the outbreak is thought to have begun. Now Thailand operates in a bubble of its own making, largely safe from COVID-19 but insulated from the rest of the world as its economy struggles to recover.